in city school study. I do a lot of physical activity research work, and like I was a practitioner for a lot of years. I worked at the city of Manhattan, Kansas. I was the bike ped coordinator, and like did infrastructure changes, worked at the city planning and public works and a whole bunch of stuff. Now I mostly just do research. We have a couple different intervention programs that are fun and we run. But yeah, let's go to Chelsea.
Hi, everyone. My name is Chelsea Blakemore with Platte County Health Department. I am on this call really for just all things physical activity. One of the big responsibilities that I have is with our child care centers and in-home daycares in Platte County. So also kind of here representing them as well.
And Chelsea, do you want to call on somebody next?
Sure. Robin.
Hi there, Robin Shook, Children's Mercy. I'm the director of the Kansas City Healthy Lifestyles Collaborative, which is kind of the backbone org for the KC Physical Activity Plan. I'll call on Teresa. You sort of already introduced yourself.
Hi, I'm a nurse and health educator. I'm partially retired. I work on our maternal child health contract is one of the things I do. The other probably big portion of my time is I do smoking and vaping cessation with mostly our WIC population, but any clinic client that comes in, and then out in the community, sometimes I go out and speak on that.
Shelly, you want to go next?
Sure. I'm Shelly Summer. I manage the Kansas City Healthy Lifestyles Collaborative at Children's Mercy, and am part of the team with Robin and Natalie and Katie. And I am going to turn it over to Wesley.
Hey guys, this is Wes Goodrich. I'm actually a second-year resident in the family medicine program over at the University of Missouri, Kansas City, and am supposed to be, I guess, a new member of the Kansas City Active Lifestyles Committee. I was introduced actually by Dr. Edward Kramer over at our program. So it's nice to meet you all and to be a part of this, but hoping to just get a little bit more involved.
Kristen, you want to go next?
Sure. My name is Kristen Schlenk from Jackson County Health Department. Mariana, who I believe was on this before, routed this over to me. I am the Community Engagement and Policy Division Manager here at the Health Department. And within our division, we have our MCH contract and our child care contract. And then also our Community Health Improvement Plan falls under my division. So touches a little bit of everything it looks like you guys are going to be discussing.
Sweet. Well, it's great to have you, Kristen. DC.
Hi, everyone. DC Oconta. I'm with the Johnson County Department of Health and Environment on the epidemiology division. And I kind of don't have any specific history with any public or any physical activity committees. I'm just, I love physical activity, and I want to be a part of a committee that is trying to provide an equitable way to get physical activity out to the community. So I'm here and I'm ready to do whatever we got to do.
Cool. Well, thanks for being here, DC. And yeah, I totally agree, right? Like that's why we are all here to hopefully get more folks active and do it in a way that is equitable. Natalie, you want to say hi? I don't think we can hear you, Natalie, or at least I can't. While she's getting that figured out, do you want to say hi, Katie?
Yeah. Hi, I'm Katie. So I work with Shelly, Robin, and Natalie, part of the Kansas City Healthy Lifestyles Collaborative team, and I offer support to this sector group.
Awesome. Well, and Katie runs it, right? Let's be real here. Like, I'm here to like help and facilitate stuff, but Katie's the guru here. So let's go ahead and get started. I'm gonna share my screen, guys, and just kind of review some of the stuff that we've already done. So last time, not last time, the time before last, I think, we ranked the public health strategies. So for those folks that are kind of newish to the call, the National Physical Activity Plan, and Robin, Shelley, Katie, anybody jump in here if I'm not saying things correctly, or if like I need additional info. So the National Physical Activity Plan is it's well established. It has a public health sector as well as all the other sectors of the Kansas City Physical Activity Plan. The KC Physical Activity Plan is kind of modeled off the national plan. So what we have done in the past is we looked at the strategies. These 6 strategies are in the national plan in the public health sector. We can go through these if we want. We'll kind of go through them in detail in a little bit. And last time we kind of ranked these strategies in terms of like, how did we rank them, Katie, in terms of importance, or like for Kansas City, like what is it that Kansas City can do here? Actually, it might be, I got too many things on my screen here, guys. It might be like right over here. Yeah. So how likely is that each of these strategies will be implemented locally? Do you think this can be implemented locally in the next 3 years, the next 5 to 10 years? And then how likely is it to improve physical activity and health? And so based on the kind of these 4 questions, we ranked these strategies a couple months ago. And this is what we came up with in the past. Now, we don't necessarily have to hold to this, but this is what the group kind of decided, was that, really the top strategy is strategy 5. Based on those 4 questions, we get 1, 2, 3, 4, 5, 6, ranking these 6 strategies. Now, these again are the 6 strategies from the National Physical Activity Plan. So the top one that we all kind of thought could be done easily, that would improve health, that like public health can do in Kansas City, in the Kansas City Metro, was strategy 5. So, and I'll just read these off real quick. So public health organizations should disseminate tools and resources important for promoting physical activity, including resources that address the burden of disease due to inactivity, the implementation of evidence-based interventions, and funding opportunities for physical activity initiatives, right? So we thought, hey, the public health in Kansas City can really do this one. It's well within all of our wheelhouses. The second one was public health agencies should expand monitoring and policy and environmental determinants of physical activity and the levels of physical activity in communities, i.e. surveillance, right? And should monitor implementation of public health approaches to promoting active lifestyles. So really this is on surveillance and evaluation of physical activity stuff. I think a lot of our health departments are pretty good at this kind of stuff. And yeah, so the group thought that was like, the second most important or maybe implementable strategy of the 6. And then the third one is really about policy development and advocacy. So nonprofit public health organizations should engage in policy development and advocacy to elevate the priority of physical activity in public health practice, policy, and research. So those were really the top 3. The bottom 3 were around leveraging cross-sectoral or sector partnerships and coalitions to implement evidence-based strategies, invest in equitable physical activity commensurate with its impact in disease prevention and health promotion. So that was kind of strategy 6 that kind of did not make the top 3 list. And then the first one was really maintain a workforce, with expertise and ability in physical activity. So that one we thought was really the least likely to be implemented in the recent future, and then less likely to change outcomes. So that's what we came up with. I want to kind of open it up for some discussion real quick before we move forward. And again, Katie, will you put that link in the chat one more time so that folks can pull this up? Is that for everybody on the call here, does that kind of those who have been here in the past, that kind of mirrors what we have said. And those who haven't been here in the past, what do you guys think about that? Are there any kind of reactions to that? Any differences of opinion? We always, like to hear that kind of stuff.
So this is Wes Goodrich, again, one of the newer folks. So I do like kind of, I think it was strategy 5 that we're starting with, that low-hanging fruit where we can really gain traction and start to build momentum. I do find that having support at the legislative level is kind of like where you can really start to gain traction. And so I think that if we have that momentum going, it makes for a much easier sell, especially with like local officials of neighboring and collaborating organizations and things like that. So I'm all down for it. I think that's a great way to start.
Awesome. I think that's a great point, Wes. And I think that I mirror kind of your comments on policy and like how to move that stuff forward. We really need more of an advocacy wing to public health than we have had in the past, especially for physical activity. So some good points. Other thoughts, reactions? Go ahead. DC.
So I was just thinking, I think it was pause or strategy kind of 2 and 6. I think with both of those, we could, along with strategy 5, like since that's a low-hanging fruit, we could definitely focus on getting partners and community members into rooms where we can discuss the best way to implement physical activity strategies, especially those communities that are struggling most, or live in neighborhoods that don't have the best infrastructure for physical activity. I think bringing in those partners, those community members, and those organizations that kind of live in and have those lived experiences and live in those neighborhoods, I think that would be something that we could do at the same time as strategy 5.
DC, I think that's a great point. And I think that the role of public health is really around that, right? And we've published a few different studies on how public health really are the folks to get people in the same room to communicate and collaborate. And they do a good job at that. And so I think you're spot on there with like 2 and 6. I am curious, like, what's the role of public health versus what's the role of, we have an infrastructure group that's kind of moving forward too, right, Shelley, Katie? Or will be in the future? Yeah, okay. So there's another group that's kind of working on like built environment and infrastructure. Doesn't mean public health is not a part of that, right? Because we all, everything kind of works together in this big mess of public things, Yeah, so great point. Other thoughts?
I guess kind of piggybacking on that comment, I was a little surprised that number 2, which is about leveraging cross-sectoral partnerships, ranked lower on these list of 6 strategies, given all the competing demands for public health officials' time, that you can only do so much, and so relying on partnerships seems, from kind of an outsider's view, to be important. So I don't know if anyone has any comment on that particular aspect of partnerships, or whether it's, hey, we just like the other 3 a lot more, and that's not to discredit anything in strategy 2.
Yeah, Robin, that's a great question. Anybody have any comments on that?
For me, it's the and.
Talk more, Shelley.
Well, if you put and/or, then I think it makes sense and might elevate in terms of the like low hanging fruit that we just heard, because we're helping to coordinate cross-sectoral partnerships and coalitions. I mean, that's exactly what this is. And public health is participating, but in the strategy, it says create, maintain, and leverage. So if you change that and to an or, I think it would fit and it would rise a little bit higher. I mean, in fact, we're already doing it. And public health is participating.
Yeah, right. I agree. And I think that there's there's a level of implementing evidence-based strategies is maybe that's a difficult thing, right? It's one thing to get people in the room to come to talk about stuff and think things through like this. It's another thing to like, you know, use the partnerships in this room to implement programming or infrastructure changes or, you know, those kind of things. It's harder, right?
I don't know what the other health department's experience has been, but what I'm finding is post-COVID, especially in my work with daycares, I think that so many businesses have been so effective by such low staffing levels that their prior partners who would have been very eager to participate are very hesitant because they want to know, what is it that you're going to expect of us in this partnership? Because we really cannot commit to that with the staffing levels that we have now. So I think that that's what I see as a huge difference, because I've worked with daycares for years and I know that other businesses are struggling too. So I think that that's a huge thing as far as getting partners to engage with you.
I think Chelsea gave a thumbs up to that too, right? I mean, I think we're all struggling with staffing. Like it's a major problem right now. So many people left public health. So many people left, you know, the work that they were doing either during or post COVID. And so now how do we like rebuild that workforce, which is strategy 1 in here, right? Which was ranked last in this kind of list of strategies. So I want to propose to the group, we can do a few different things today. I want to make our time valuable, obviously. And so, you know, at the end of this process and over the next, you know, couple months, we want a list of strategies and tactics for Kansas City that are good for us that we can then go and implement. And I want to, for the new folks on the call, we do have funding to implement some, whatever it is we think is valuable. So Robin and the team have found some cash to help us implement what we think is important and valuable. So at the end of the day, maybe not today, but at the end of, you know, the next couple months or whatever, if we can, you know, hone in on a few different tactics that we can actually do something about, there's already some money available to do that, and we can move it forward. So I want to propose 2 roads today. One road, and please jump in and let's have a conversation around this, and then we can get the work done. One road is, would it be more valuable to kind of identify maybe the top 3 or 4 strategies and then look at the tactics within those strategies and move it forward and call it a good, right? Or should we keep moving on these strategies? And we have some stuff built in here where we can, you know, kind of identify what's already being done, who can implement it, some barriers and this kind of stuff, and work through this for each strategy. Or is it enough to say, okay, we know these 6 strategies, right? Can we, using the information that we've done in the past, can we go ahead and identify, you know, however many strategies we think we want to move forward? That could be 1, that could be all 6, that could be 3, it could be however many, and then look at the tactics today. Or do we want to keep thinking about which strategies are most valuable for Kansas City? What do you guys think?
I think we should think about what strategies are most valuable for Kansas City. I think we should brainstorm that. I think the strategies on here are fine. It's just I don't quite agree with the ranking of them or which ones are priority. So
Chelsea's thumbs up too, so that sounds like a good thing. Other folks? Teresa, Martha, Kristen, Wes?
Yeah, I'm good with working on the strategies.
Okay, cool. Sweet. Okay, I think everybody's in agreement. Cool. So let's work through each of these strategies. So we're going to use this Jamboard. Katie put the link in the chat. So let's look at each of these strategies and really identify, you know, who can implement this kind of stuff, the barriers to success, you know, overcoming these barriers, etc. So we'll kind of go with the list. We have all 6 in here, so we'll get to all 6 regardless. We put these in order of kind of like how we did it, but you know, how we ranked them before. But let's just move forward with them in that way, and we can do all 6 and call it a day. So on this Jamboard, guys, I'm going to keep sharing my screen so we're all on the same page, but jump in, click on the link, and open it up on your own screens. And if you go to the left side of the screen here, there's like sticky notes, there's the selector. Those are really the only 2 that we're going to use. And so if you click on something, you can go ahead and type. You can click on sticky note, you can go ahead and type in here, save, and then move it around to where it needs to go, right? So it's super easy, super efficient. Shouldn't be anything, you know, super complicated. If you can't do it and you want me to write something down, or Katie or somebody else, just let us know and we can like type it in for you. Cool. So, okay, so I'm going to read off the strategy and then let's think about, is this already being done? And you can say yes or no, or any mix of the, you know, whatever it is that you want to put in here. Who can implement this work? Who can implement this strategy? What are the barriers to this strategy? How do we overcome these barriers? And then who are we missing? So we have, you know, mostly health department folks here. But is there somebody else that we need to bring in to really help target this strategy and move it forward? So strategy number 5, public health organizations should disseminate tools and resources important for promoting physical activity, including resources that address the burden of disease due to inactivity, the implementation of evidence-based interventions, and funding opportunities for physical activity initiatives. So is this being done? I'm gonna say no. And feel free, guys, jump in here. Okay, there's a couple different ones. And use the selector tool. I mean, I might help kind of move stuff around a little bit too. Oh, sorry. So we got not enough. How will these resources be shared? Will it be seen on a website? Right, exactly. That's a good point, you know? So like, if it is being done, it's not being done maybe in a way that's being shared widely or being disseminated widely. A lot of people say no. Okay, so I'm getting the general sense that this strategy is not being done in Kansas City. Okay. So yeah, feel free here. Who can implement this strategy? So like, I'm gonna say like, this is a really good job for like health department staff. Specifically like disseminate MCH, I think would be a good one, maternal child health, health promotion folks, right? Who else can implement these? The stats folks. So the epidemiology folks, I think would be good, right? That's a good one. Mark coalitions. Community health workers would be great at this, right? If there's a way to train community health workers to do physical activity stuff, that would be awesome. We have violence prevention community health workers, but we don't have like a lot of physical activity community health workers. Who else, guys? I think of like who can do the work. Is there somebody we're missing here? Like who can lead this? I mean, do we need like directors of you know, units or divisions, or how, you know, all the health departments call it something different, but like maybe not the director of health, but like somebody else in there. That's a good one. Like high profile communicators. Super valuable. Oh, thanks, Teresa, for putting stuff in the chat too. Sorry, I'm just like seeing everything. Yeah, good point, Martha. The answers really do vary by jurisdiction, right? And we're kind of focused on the metropolitan wide stuff. And like, you know, the overarching goal is like, how do you impact physical activity for the community, right? Robin?
One quick question, and we're all reading the same text, but I'm curious how you guys interpret it. Is it, are we, when we're thinking about implementing, are we thinking about the dissemination piece of the strategy or the development piece? And I guess maybe development of these resources isn't specifically in the strategy. So maybe we're assuming that like this information is being created elsewhere. We're just sharing it. Is that how you guys interpret?
That's what I was thinking of, just sharing. How are we sharing the tools and resources that are already out there?
Yeah, I think that makes sense.
Other folks? That's how I took it too, Robin, is like, you know, we're not developing the material, but like sharing like a CDC fact sheet on physical activity, or, you know, figuring out how to like disseminate that like physical activity is good for you, you know, all the stuff associated with that. So if we were to implement this strategy, what are the barriers to success? I think knowledgeable staff is one, right? We have to have staff that know something about physical activity in order to figure out how to disseminate it, right? Yeah, this is a great one, right? Culturally and regionally appropriate. Like I always have the question, are like resources actionable? Like, you know, does it really help folks engage in physical activity, or is it like physical inactivity shaming, you know? Like you should be like finger pointing, you should be active, and like, you know, this is what it means, but it doesn't give any like actionable steps on like how to walk or where to walk, or, you know, how to overcome barriers or those kind of things. This is a great point. Is it simple, eye-catching, those kind of things? Health literacy, that's a good point. Yeah, limited capacity overall, so like lack of knowledge, funding, staffing, partners, etc. to disseminate stuff. Yeah, this is good. Like not sure physical activities, or the public sees physical activity as a priority. So folks are apathetic towards physical activity, right? Like they know they should be active most of the time. They know that like it's a thing. But really, you know, honing in and making it a priority is definitely a challenge. And it's a challenge for us too, right? Like we have to be a little understanding of that. It's not always super easy. So how do we overcome these barriers? What does that look like? I love this. Like to overcome barriers, you need a high profile communicator. Somebody who, I remember when Quentin took swim lessons, right? He grew up, didn't know how to swim. And when he was 30, I think, this is just a few years ago, because it's like 30, it's a couple years younger than me, right? 36. He took swim lessons and like, you know, promoted it. And it was a great thing. That's fun. Cross-sector collaboration is key, absolutely, to overcoming these barriers. I think this is a great one, right? We need some marketing people. Like public health, we're not good at marketing. If the pandemic doesn't show us like we can't communicate effectively, I don't know what does, you know? Chelsea Harding. Is that Harding my comment, Chelsea?
Yes, about the marketing. That made me giggle because really public health and marketing sometimes does not go hand in hand and they don't care what we have to say.
Guys, I'll tell you, public health is good at a lot of things, like communicating effectively so that people understand what we're trying to say is not one of them, right? Empowering people to take agency and interest in their own health. That's a great one. I love this, like focusing on communities and neighborhoods. Like the Kansas City metropolitan area is not one, it's one metropolitan area, right? But every neighborhood is very different. And you know, you guys, I don't know if you know this, but Kansas City is the 5th most economically and racially segregated city in the country, right? The Urban Institute did this report a few years ago now. And every neighborhood's really different, right? And the strategies that work in, you know, Johnson County, some of the neighborhoods in Johnson County are not going to work in some of the neighborhoods in the Northland, you know? So that's one aspect of Kansas City that's important. Who are we missing in this work? One of the folks that I always like think of are like fitness professionals. Can't spell today, guys. Folks that, you know, already work in the community, and think folks like Nikki Fit, you know, Nikki Jones, who is awesome and has, you know, the pulse of the physical activity stuff on the east side. She does great work. We work with her a lot, and you know, she's somebody who maybe doesn't have the time to like come to these things, but it definitely is somebody who can leverage community and get involved. Who else are we missing?
Joey, I think to piggyback off of the fitness professionals, I would say even just like the YMCAs, because they are all over the metro, not just in certain areas. So then, I mean, if we get them involved and they kind of make it a like metro wide whatever, then we're kind of having the same message throughout the metro, if that makes sense.
Yeah, great point. So public health folks in the room, right? And we're all active, but maybe the physical activity folks are not in the room. The people who like deliver programming. Neighborhood leaders is a great idea, right? This is a great one, right? This is a good one. Who did you do this one, Katie? Values work and busyness over. Oh, sorry, is it from the chat?
No, yeah, it's from the chat. I'm just
Oh,
putting it in as notes.
Sorry, Martha, I'm trying to do so many things at once, but yeah, great comments. Jobs are increasingly sedentary, so jobs are really important. Go ahead, sorry.
Well, I was just saying, I think it's interesting what Martha put about health plans. Like, how can we get into health plans and making it more, I don't know, reimbursable, I guess, for people for physical activity? How that looks, I have no idea. I'm not that in that realm, but I like that idea.
And to piggyback off of what you said, was that Chelsea?
Yes.
Like in Johnson County, there are incentives if you are doing a certain number of physical activity things in a certain period of time, like before July or something like that. So having maybe on top of, you know, having reimbursement for certain physical activity things, but also having incentives for like you get a discount on your health plan if you do so many days of physical activity during the year, and then at the end, or if you go to the gym for a certain amount of time. So yeah.
Yeah, we need more of that, right? Like, so, like, I think the state of Kansas has like the federal government has like the $20 a month reimbursement if you like bike or walk to work, you know, but like nobody takes advantage of it. And yeah, I don't know, you know. So let's just like review this strategy real quick. So, I mean, there are some barriers, right? We can all kind of come up with barriers to all this stuff. We're missing some folks in the room, but overall, what do you guys think about this? Personally, I think it's like something pretty low hanging fruit, right? Something that we can do that is realistic and a good first step. What do others think? I don't know if it's going to make a huge change in this right here. This is, I think, ranked lower than the other ones because I think it's easy to do, but I don't know if it's likely to see a lot of like community impact. Justice?
Yeah, I agree with you. It's gonna be hard to see how this impacts the community.
Yeah, that's kind of what I was thinking too. To me, this is like a low hanging fruit type object, which was a little surprising to me why it was, and maybe it's just a fluke of the rating system, that this actually got a higher rating for a 5 to 10 year goal rather than a short-term goal. So maybe it's, like I said, maybe that's just a fluke, but to me, this is just like something that's an easy win, a relatively easy win. That's just my opinion.
Other comments? All right, let's move on to the next one with, remember, you know, all the stuff that we kind of talked about here. And I think we can move a little quicker. Oh, sorry. Well, hold up. Thanks, Katie. Before we do that, let's figure out where strategy goes. So we have this prioritization matrix, right? So on the top here is how difficult it is to do. So if it's easy to implement, it kind of is here. If it's hard to implement, it's here, right? And on the, I guess, y-axis is the impact. So if it's has a high impact and is likely to change, you know, physical activity, then it would go here. If it has a low impact, it's going to go here. So the top left, easy to do and has a high impact. The bottom right, hard to do and has a low impact, right? So I'm going to pull this and I'm going to say, yeah, quick win. Am I a llama? What am I? Yeah, I think we're all on the same page, right? All right. Okay, so let's move on to strategy 4. So same thing with strategy 4. So let me read this real quick so that we're all on the same page, and then I think we can move forward with this a little quicker. Public health agencies should expand monitoring of policy and environmental determinants of physical activity and the levels of physical activity in communities, i.e. surveillance, and should monitor implementation of public health approaches to promoting active lifestyles. Evaluation. So is this already being done? I'm going to say to some degree.
And I think the key here too, right, is this is public health agencies monitoring. Not like is it being monitored by someone else? It's just public health, right? So
yeah, and I mean, in that I would say like using BRFSS data at the local like level. So while the data are collected at the state level, you know, if like Johnson County is great about using the physical activity data from the BRFSS, I think that would be, you know, surveillance. Maybe that's a good point, that like, yes to surveillance, no to evaluation. What do you guys think about that? Maybe a more clear. Touche, right? If it's not well communicated, how do we know? You know? So again, back to this communication problem in public health. So not their public health agency, totally. So if we wanted to do this, who can implement this? So this is like epi folks, right? Anybody else? Maybe health promotion folks? I mean, that's really who focuses on this stuff, right? Surveillance is going to be all epidemiology, pulling, data from somewhere and or, doing that kind of stuff. And then monitoring the implementation of physical activity. Can I make a recommendation that the Healthy Lifestyles Collaborative could be this group too, right? To survey what's happening in terms of implementing, physical activity, public health approaches, to understand what's going on. Putting work on. So.
Well, I would just say the strategy only talks about public health agencies.
You guys aren't part of public health, Robin?
Yeah, it's a good question. What is the boundary? What is the inclusion criteria for public health agencies? Is it your official government sponsored health department or something else? Yeah, that's a good point.
The public health folks in the room, what do you guys think about that?
Personally, I think public health agencies should encompass anyone who's trying to improve the overall community health, in my opinion. I don't think it needs to be just a public funded business organization, whatever you want to call it.
I think at minimum, it's valuable for health departments and nonprofit health systems who have requirements for community health needs assessments to partner in their efforts and coordinate so that we do a better job of surveillance and across the lifespan. So for example, with Children's Mercy's community health and needs assessment, we're really focusing on kids. But health departments would likely focus on either adults and kids or more adults that we're not getting.
And I will also, I'll just add that, I think when it comes to governmental public health, right? Like Johnson County Health Department, Kansas City, Missouri Health Department, Jackson County Health Department, there's sustainable funding mechanisms in place that if those people do things, or the hospital systems, right? The nonprofit hospital systems. If those people do things, then it has a tendency to stick around a lot longer, right? If it's a nonprofit group or somebody else that is either grant funded or has competing demands or other priorities, that stuff often doesn't stick around. So in terms of surveillance, this is a multi-year, multi-decade issue, right? Not a, it's hard for a nonprofit organization to do that kind of work, right? That's the role of government, isn't it? I don't know, that's what I think. But great point on the community health assessment, community health improvement plan stuff, right? That's a key thing. It's a foundational public health practice that should be used. And so I think one easy win could be getting physical activity into every CHA and CHIP, right? I think that's a really important thing that we could do because it's a foundational health behavior, Okay, so what are the barriers to success? What are the barriers to this? I would say public health focus or initiatives. The public health departments are not focused on this, right? They're more focused on things that are tied to funding, maternal child health, vaccines, STI, right? I'm just gonna say focus. Unclear competing motives between partners. Whoever said that, can you talk a little bit more about that?
Yeah, so we kind of got into whether or not we're only depending on public health agencies or Children's Mercy or other health systems are part of that public health process, which I 100% believe, like, if you're, focused on community and you're doing work to better the health of the community, you're part of public health. However, without clear without clear guidance in what our end goal is, there may be competing priorities between different organizations, and that could hinder the overall program or the overall action that we're trying to do. Hopefully, hopefully that was clear.
Yeah, I have a question, DC. Do you think that this is my perception? So I just want to see if it's like the same for everybody else. Do you think that when a new health department director comes in, or like staff changes, it could be at the director level or other levels, priorities for the organization change, right?
I would say so. I would say so. Only there's like, for example, Johnson County is going through a change, and like it depends on what the department is looking for. If that person is going, if they're going to a positive change based on like Public Health 3.0, and they're looking for someone to kind of change or like head in that direction with them, to a certain degree, yes. But if they're going a totally different direction and a director is coming in and the health department isn't quite as equitable or quite as partner savvy or any of that, and the director is 100% equity, racism, all of that, then that could totally change the trajectory of a health department. So kind of both in a way. Sorry, I didn't answer that clearly.
No, yeah, totally. It's complex, right? And there's like not a, yeah. And so if we're focused on physical activity and getting folks active, like how do we use the levers of government and public health to make that happen, right? One of those, I think that like I didn't think about before this, was like accreditation, right? There's standards. If you look at the FAB accreditation standards, there's standards around disaster preparedness, CHIP, CHOS stuff, but nothing in physical activity, nothing in nutrition, right? And so how do we eventually, is there a way to tie, accreditation to the root causes of behavior, which, I mean, we could have a long conversation on all that stuff. So Teresa, at Clay County, our strategic plan is set up an administration team board. Yeah, collaboratively with staff input, totally. Good point. This is a really good point too. So lack of sustainable funding and routine and regular monitoring, right? So like, how do we tie funding from, local, state, federal sources to surveillance or evaluation around physical activity stuff? How do we overcome these barriers, guys? Continuously have these conversations. Agreed. I think of funding, right? If there's a way to like tie, half of somebody's job to funding, then like they're focused on that, right? Cross-sector partnerships, yep. Like policy and policy, right? So how do we get physical activity into big P policy? So like complete streets, CHIPS, CHAWS, that kind of stuff. And then little P policy, like our health department is focused on physical activity, right? So it's a practice that we do. What else? That's a good point. Yeah, some overarching agency or coalition that monitors across many partners. Maybe that's a really good point for Kansas City, right? We have 2 by state, 800 county, 7 million city like area, and working across all of those jurisdictions are very difficult, right? Yeah, that's great. Okay, so who are we missing? Epidemiologists from each public health department. Yep. Funders, always, right? I would say the academics who are focused on surveillance, but we kind of are here. We don't, is there, Robin? I mean, there are some academics that focus on surveillance, right? But we don't have any surveillance physical activity folks in Kansas City.
No, not that I'm aware of at all. It's maybe some people who moonlight at it as doing some of these things, but yeah, it would be great if like UMKC School of Nursing had a position that their job was physical activity monitoring. And it doesn't have to be UMKC, but some group had that as part of their mission. I think that was kind of in the other one, the fun part, FTA for PA.
Yeah, totally. Or if one of our organizations could strategically hire a physical activity surveillance person, that'd be great. So let's move forward so we can make some progress here. So prioritization: easy, hard, high impact, low impact. What do you guys? I'm not going to go first because you guys can all see my answers. I'll wait till everybody else gets done. I'm going to put this. Can I put it like as close to the line as it can get?
Yeah, you can place it anywhere.
Wes had to go to the clinic. Okay, so hard to do because it requires like time. It's going to take a lot of time, right? Talk me through this. Why did you guys put where you put?
I think this is Kristen. From my perspective, I put more challenging just because it's hard to get timely data, not just data, but real-time data that we can then base our initiatives off of.
Kristen, that's a great point, right? Physical activity data is always a year behind. They're mostly always, right?
Yeah, or more, or we can't get more local level data, so it's harder to really understand the community without having that real-time data.
Well, and the surveillance measures that we use are pretty much trash, right? Like they're terrible measures. It's like, did you at all work out in the last 30 days for any type of like leisure only physical activity, right? Does not account for like transportation, occupation, household, all that kind of stuff.
That's actually a great point, Joey. We've been talking about surveillance being just subjective survey type responses, but it doesn't have to be. For example, how many people are wearing Garmin devices or Fitbit devices, which that data is available.
That's an easier win, right? To get the Garmin data from Kansas City. I don't know, there's legal stuff with that, but I'll tell you, I put it here because I think it's less difficult than we think it is. We just have to have the time and energy to do it, right? But I don't think it's gonna, like, why did you guys say that it has a high impact?
I feel like with anything, especially in a public health standpoint, at least with like my board and if I don't have the data set up, then like I kind of need to show like it is an issue and we know it's an issue, but I need to say that to my board. So that's why I'm thinking it is kind of a higher impact than a lower impact in my case.
Like if you don't have this, you can't do something else. Is that what I'm hearing?
basically.
Yeah, like if you don't have the surveillance data, you can't justify spending money on something to then change because you don't know, right?
Right, exactly.
That's a really good point. Why else, guys?
I think along those same lines is, using the data to tell a story to not only the people you work for, but to the public or to other key stakeholders, right? Like there are a whole list of problems that people in Kansas City and challenges that people in Kansas City face. I mean, the past 5 days, 6 days has proven that there are many more acute things that people are dealing with in our region than, physical activity. But with the appropriate data and with the appropriate storytelling, you can make the case for why physical activity and opportunities for physical activity are important, and while we're not competing with things like gun violence, we can't just ignore it altogether. So unfortunately, I've got to go to another meeting. So you're done with my opinions here, but
Yeah. And just to piggyback on what Robin was saying, I think having the information is important for key stakeholders to engage. So business leaders, insurers, without the data, the mechanism is not going to get put into place to continue, for example, billing and reimbursement from insurers for physical activity as treatment for chronic disease, or employee wellness businesses to support employee wellness efforts if they don't know what's working. So that's more on the evaluation, not just the surveillance, but they're sort of hand in hand.
I mean, it sounds like this is one of those threshold things, right? That like, if we don't do this first, while it may be difficult, we can't do anything else, right? So that's a really good thing to think about as we're moving forward. Anything else on this strategy? All right, let's do one more today, and then we'll take a break and we can move forward. And maybe we can like change it up so that next time we do the tactics for these three, and then we maybe come back to the other three. What do you think? Does that work for everybody? Yeah. So strategy number 3. So this is the third ranked kind of strategy that we focused on last time. Nonprofit public health organizations should engage in policy development and advocacy to elevate the priority of physical activity in public health practice, policy, and research. Is this already being done? I'm going to say not by local public health. I think it's being done by groups like the Healthy Lifestyles Collaborative and other folks, but not by local public health. Other thoughts?
I just have a question of, besides this, like Kansas City Healthy Lifestyles Collaborative, like I'm having a hard time with other nonprofit public health organizations. Like, is there anyone else out there? That sounds really bad, but is there?
Katie, Natalie? Like besides governmental public health, I mean, Chelsea?
Yeah.
Hmm.
I think like
Like,
the
I
Heart
mean-
Association or like those types of organizations,
What did you say, Natalie?
like the American Heart Association, like the local ones, Alzheimer's,
Yeah.
all those disease ones.
That's a good point. AHA, American Heart Association, does a lot of like policy stuff, and they're really great, right? They help do the like Complete Streets Ordinance in Kansas City, Missouri, and like other things. But they're very heart focused, not physical activity focused, right? I mean, they're like, their goal is, heart disease, not like increasing physical activity. I think those are oftentimes, I think those are competing demands. So not
Technically the YMCA, I guess.
Yeah, the Y. And like when they had, what was her name? She was great. She used to work at Cerner. She was at MD. She's super awesome.
Daphne.
Yeah, when Daphne worked at the Y, she did some of this, right? And then she moved on. And I think everything kind of fell apart. That having a good leader, having a good advocate, is really important. Okay, so who can do this? I actually, can I take a pause here? I will say Bike Walk KC does. They have it, they're great at this kind of stuff, right? Now they're focused on biking, but it is physical activity, right? Who can do this kind of work? Like we can do this, right? We can do UMKC, my job. Like we do advocacy policy development, right? Public health practice research policy. Run 816, yeah, that's a great one. Hey, yeah, the more I think about this, I'm like the Brookside Running Club, like those folks.
Right, they're all compete, like doing different types of physical activity, but they're all physical activity, so it's a little different, but it's still in the same umbrella. Is that what we're?
Yeah, Soccer for Success, right? Is that really like policy development and advocacy? I'm definitely advocacy, right? Maybe we have more advocates than, like policy folks. Okay. Who can implement this? Yeah, Girls on the Run does some really great advocacy. All right. Schools are not doing enough. Right. We know that through some of our work, that schools are just overtaxed and tired. All right, who can implement this? So I'm gonna put here, we'll just move this over here. Schools can do this, right? Sorry, Katie. Whoever's changing stuff. Local fitness groups. Who else? Yeah, community centers. This is one of those things I think where city municipalities, like neighborhoods, like can use PIAC funds to do physical activity stuff, infrastructure, whether it be like sidewalk or, bike lanes or whatever, right? What are the barriers to success? I think like long-term advocates, right? So like, when Daphne leaves the Y, like she's gone, right? And she was only around for a couple of years, I think. Yeah, policy totally freaks people out. It's a long road. Policy is a long road. Right? It takes time to change policy, which is good and bad, I think. Lack of awareness, right? Even the folks that are like focused on physical activity, we don't even know who's working in these spaces. I think that I think we're like PA folks are too focused on the short term and not short term and programming, which we know through the literature, right? we're like, oh, how do we get people active? You get them active, right? Instead of like building the policy and environments around getting people active. All right, how do we overcome these barriers? Create some language to share with everyone. Yeah, totally. Develop an advocacy committee or coalition. Focus like on one policy to solve, right? That's what Bike Walk did when they did the thanks, sorry. Complete Streets ordinance. Who's missing? Mark is great. Yeah. We need, like, you guys like know who Mark Fenton is? Mark Fenton, America Walks. He was like a national, like Olympic walker.
He's amazing.
Okay, you know who Mark Fenton is?
Yeah, I got to meet him.
Oh my God. He's crazy.
Yeah, he's nuts, but I could listen to him talk forever. He's a brilliant man.
He's a biomechanist, but he was on the Olympic walking team. Remember when like speed walking, like the spaghetti walking style, you know how like you take a piece of spaghetti and like that's what they look like walking down the road. He's hilarious, but like he's a champion for walking, right? A national champion for walking. And like we need a champion, somebody to like be the physical, we need like a Robin Shook of, you know, for Kansas City. Okay. Let's quickly do this, guys, and then I'll give you back some time today. So when we think of policy development advocacy to elevate the priorities of physical activity, is it difficult? Is it hard? Does it have a high impact or low impact? Yeah, I think we're all in like it's important work, right? It's good stuff, but it's gonna be hard to do, right? So oh, here we go. So I think that is a good start. That's good work for today, guys. I think the next step that we should do, and like Chelsea, DC, jump in here, but I think that we should take the tactics for the 3 areas that we focused on and really kind of hit home and like, do we need to focus on this here? Some of them around like the policy stuff just don't make sense for Kansas City, I don't think. Other ones do make sense, but we maybe should tailor it for Kansas City, you know? What if we did that next time, really focused on those, and then if we have time, we can go back to the other strategies. What is it, 1, 6, and 2? Go ahead, Katie.
Here's my one thing. After today's discussion, it seems like strategy 5 may not really be a priority for us. And we still need to figure out what strategies we do want to include. Do we want to include all 6 or are we only looking at 3? So my recommendation is, I know it's a lot, it's tedious work, but we're making progress.
Yeah, I agree. I kind of want to like mix it up a little bit, if that's cool. So like, so we can focus on tactics for these guys, and maybe we can get that done quickly, right? And say yes, no, yes, no, yes, no, move on. And then we can come back to the strategies and be like, okay, are these important or not, you know?
Yeah, would you want to instead do another ranking? So rank the strategies like the first slide we saw. And, you know, at this point, we can determine, okay, obviously the last 2, we're not going to focus on anymore. And then we look at the tactics, and I can just make sure I've got tactics for every single strategy pulled up.
But I mean, I don't have a really right answer for that, Katie. I think that like,
yeah.
Chelsea, DC, what do you guys think? Do you think that like we're going to end up focusing on all 6 strategies and then only a few tactics within those strategies? Or do you think that like one or 2 of them will like get kicked out of the mix, or 3 or however many?
I think we'd be more impactful if we only focused on maybe 3 strategies rather than all 6.
That's what I think, right? I think that like, let's like hone in the next, 5 years or however long this plan is, right? Get some work done. And then like, if we can stand out later, then let's do that. But so I guess go ahead, Chelsea.
Well, I was just gonna say, yes, I think that's a good idea, so.
Do you guys, what's your general sense, guys? Would you rather focus on like long-term stuff that's going to be high impact, or short-term stuff that's going to be low impact? So if we go back to that diagram, is it the easy wins? Yeah, the easy wins or the long-term challenges, right? I mean, is there a easy and high?
I feel like, I mean, just thinking about like maybe a little more selfish, but I feel like I would want help in the stuff that has higher impact that's a little bit more difficult. Like,
Mhm.
I could probably do like a couple easy wins, like for our health department, like on my own type thing, if that makes sense. Again, it's probably sounds really selfish and I really don't mean to come off that way, but I feel like as a group, like we should probably focus more on the hard stuff that's gonna have more of a higher impact.
DC, what do you think?
I don't know. I'm kind of a bit torn because I feel like there are some things that we can do that are easy and high impact. But I tend to agree with Chelsea that since we're all from different sectors, we should, or not, well, different organizations, we should try to focus on the long-term stuff. And I do think there may be some things that we can do that's low impact, or not low impact, high impact and relatively easy. Like I don't know how much connection we have, but like I'm thinking like setting like a Kansas City wide like physical activity week or something like that. Like something like that would be, I feel like extremely easy to do if you got the right people to, get behind it. But yeah, we should focus on the long-term stuff.
Or just, I'd like all of our cities, not all of them, but a lot of them focus on like National Bike Month, right? But it's not cohesive across, the metropolitan area. Like Johnson County does their own thing and like they have their stuff down there. Bike Walk does a lot of stuff in the urban core. And that's really great, but there's no connection between these major like things that are happening, right?
Right, and that could be something that could be a hard and high impact thing too. Just trying to get all of the different jurisdictions to get some cohesion and do some of these physical activity plans at the same time during the year. But then after you do that, then you have more of the high impact, easy stuff where we're all setting this event on this week or this day, but it's happening across the entire region. So
yeah, cool. I like that. So so let's keep thinking about this. And Katie, I think I'm along the same lines that like I would rather do the hard stuff that like has impact than I mean, if we could get some quick wins in, like that's a good thing, right? But we're all here for the long term, right? We're invested, we're like gonna keep going and move forward kind of regardless of what happens.
Yeah. Really quick, for those who don't know, the Kansas City Healthy Lifestyles Collaborative is our sports sector, is working with Aspen Institute to do a project play report for the Kansas City region. So that's kind of that surveillance aspect of anything involving youth sports. And then I know we're working on a different project. It's a mapping project. Natalie knows more about it than I do. And we're looking at all organizations that offer youth like programming, youth sport or physical activity programming. That is something related to that surveillance one. I was just thinking that low-hanging fruit. But Leitner, do you want to talk about your student before we go and your CHIP project?
Yeah, I mean, I'll just kind of update the team and like, so I have a student, guys, I do some work on CHIPS, community health improvement plans, and like try to understand. I'll be very honest, I don't think they work, right? I think that like they're put on the shelf, they take all this time and energy to develop, and then like we say that we're doing them. They're supposed to guide public health practice, right? So like you do this chip, it guides your health department for the next 5 years, doesn't happen, right? And so I am on a mission to understand more and more of this stuff in order to like help FAB improve their process. So I work with FAB too, and like I'm a site reviewer, and then also I have all of the FAB data. So all the accreditation data that's sent by every accredited health department ever. I like doing some studies with that stuff too. So we have a student who's going to go figure out the cost of chips around the metropolitan area. So I might have to connect you guys with them. But as part of that, since we're already doing a survey of the whole metro, we're going to throw in some physical activity questions to see what health departments are doing. Now, the data, I will tell you, are going to be complicated because the people who focus on the chips are usually not the people who focus on physical activity, right? And so for a big health department like Jackson County, Johnson County, Casey Mo, right? If you have one person answer the survey, they likely will miss some stuff that's happening, right? And they don't quite know. They know like the diabetes prevention program is happening in Johnson County, but they don't know the physical activity components within that, right? So like there's all this complicated stuff. So we're gonna send out a survey over the summer. If you guys want to help with it or like want to get involved in any more research, happy to like, make that happen too. But yeah, I just wanted to tell the team that, and like, if there's anything we should do, please let me know. Cool. Yeah, next meeting's May 18th. Be safe, guys. I might not be able to make that meeting, Katie, but we'll talk about it.
Yeah, so I'm not sending out an invitation until you and I discuss it, but this is
Yeah.
supposed to be. Yeah.
Thank you. My sister is
You're
graduating
welcome.
with her master's degree, and it's on like a Thursday or something. Whatever. That's what it is. But okay, guys, have a great day. Thank you so much for all of your input. DC, great to meet you, and we'll chat next time.
Thank you,
Great to meet
everyone.
you guys.
All right, guys, be
Nice to
safe.
meet you.